BBC London 94.9.
London's news, London's stories. Now, we've been hearing a great deal about statins this morning, all sorts of anecdotal evidence, but this is a brand new report in the Lancet. Do you take statins? Have you been concerned at the differing stories that we hear about whether they're beneficial or whether they have harmful side effects? A major review of statin therapy, which has been published in the Lancet, has concluded that the benefits of taking them outweigh the harms. The authors also say the benefits of statins have been underestimated and the harms exaggerated. Dr. Malik is a cardiologist at Hammersmith Hospital. He's 50. He takes statins himself as a purely preventative measure. Hello, Dr. Malik. Morning.
Good morning. How are you?
I'm very well, thank you. And I know you're obviously at the peak of health due to all the statins that you keep on consuming. Why do you take them? Why do you prescribe them for yourself or have a colleague prescribe them for you?
It's because really I believe the data that's been around for many, many years. I've thankfully not had a heart attack or stroke, so I'm in the primary prevention camp, the prevention camp. And I must say for many years I've believed the data. Mm-hmm. I certainly do believe that some patients can get side effects. I'm lucky in that I do not have those side effects. But when I don't have side effects and I know the benefits, then the question is, why would I not take the statin?
What are the benefits? What do they do, these little pills?
So they lower your cholesterol, and by lowering your cholesterol, then you reduce your risk of having a heart attack or stroke. Heart attack and stroke is mainly caused by a build-up of lipid, plaque, fat in your blood vessels, and the statins do two things. One, they leach it out a little bit, but you're not going to really reverse the process. More importantly, they sort of build a brick wall over it, so they solidify the plaque so it doesn't become unstable and rupture a bit like a volcano.
And I mean, we've already spoken to a doctor this morning. He is a doctor who doubts the efficacy of statins. I'm sure you're familiar with him. And he said that a study, or many studies, have shown that if you take statins every day and you're in a high-risk category, you will live ultimately 4 days longer than if you hadn't taken them. I'm not sure where he gets this information, but have you heard this assertion before?
I have. Quantifying how many days extra life you get, I must say I've never done that for a patient. Mm-hmm. All I say is that if you'd like to reduce your risk of having a further heart attack or stroke, and none of us are God, we don't know if it will happen, but the data would suggest that you reduce your risk if you take a statin by 1/3. If you'd like that risk reduction and the side effect profile is so low that I think it's always worth trying, then take the tablet. If you do not want to have that risk reduction, and I do always tell patients I'm taking a statin myself, then I'm not forcing you to take it. My job as a doctor is to advise, not to force anyone to do anything.
So, over the age of 50, any patient who comes to see you, Dr. Malik, and says, "Hi, doctor, I'm over 50, I'd like a statin," you would say, "Sure, here you go." Would you?
No, so the NICE guidelines changed a few years ago. So NICE is our sort of governing body that recommends things. And so I'd just like to clarify that there is that group of patients that I really think would be foolish not to take a statin. They're the ones who've already had a heart attack or stroke. Mm-hmm. The larger group of patients is, like myself, those preventing problems in the future.
Yes.
And it's not just about your age. I think everyone over 50 taking a statin, well, personally, I think that's not a bad idea. I wouldn't want the NHS to pay for it. I pay for my own tablet because I think that may well be unaffordable with any other things we can spend money on. But actually, if you have even one other risk factor, I think, of course, it makes sense. So if you are 50 and you have high blood pressure, if you're 50, you have diabetes, if you're 50 and you smoke, if you're 50 and you're overweight, then I think certainly you should really be considering taking a statin.
How overweight do you have to be overweight? Aren't we all pretty much overweight? How overweight do you have to be for it to be worth it if that's your only risk factor?
That's a good question. Again, on another channel this morning, I heard about the study coming back to say that obesity was linked to cancer.
Yeah, I heard that too. Yeah.
So I think how overweight? Well, I think if your BMI is over 30, I'd certainly say you're beginning to get a weight problem. But if you can pinch more than an inch around your waist, you're probably not quite as slim as you could be. And I think, unfortunately, most of us can do that.
Well, thank you very much indeed. That's Dr. Malik. He practices what he preaches. He puts his mouth where his money is. He pays for his own statins, but he takes them purely preventatively. Would you like to, having heard that, are you more likely to? The story this morning, the side effects have been exaggerated. The benefits have been, if anything, played down. If you don't want a heart attack or a stroke, and none of us does, thank you very much indeed, we should probably all be taking preventative statins. What do you reckon? Are you taking them? 0207 224 2000. We will be straight back with you after the news headlines.